So, good morning.
Start, sir. Yes.
Yeah. So, good morning, those who are attending today's session. Last session, we discussed on the 14, 15, 16, these three modules. And today we'll continue with the same modules with some practical examples, more practical examples, because in the old course also and in the new course now, the old course is now the new course. So the new course, there's a mandatory marking for the case studies. Now, so that is why I want to give more emphasis on the case studies because in the book or study material, you will get mostly the discussion on the chapters. But case studies are very unique because what will come in the examination hall or what will be in the paper, that is very difficult to guess. Anywhere, anything can come. Say, for instance, in the old course in 2016 syllabus, this time this audit of hospital as a case study was selected. And in the new course also something has been selected, which I am to just find out because I was not in the examiner of the new course. So that is why, but still in the study material or in the your uh, this mock questions, institute has already posted some of the case studies. So I will basically discuss on the case studies, how to go about these case studies, which will give more clarity on answering the case studies as well as getting good marks for the same. So without uh, dwelling much on this, I'm going to straight away the audit of hospitals. Now, hospital service, all of us, some point of time already we are habituated with that sort of organization, and also many of us experienced the hospital services. But while writing, what is generally seen that maybe there are 8 marks allotted, but for the 8 marks, people either write 24 points, and in the 8 marks for the 24 points, but the major points are not there. So that is why I'm just guiding you people that while because the number is selected 8, 9 like this. So in that periphery, you have to conclude with the most important points because otherwise the small points that may carry some lower mark because it is not that you have answered the question. Sometimes someone is getting 7, but someone is getting also 3. Now, why these 3? 3 is because that you have not considered the important points. So let us think of a hospital. What is the main processes? In the hospital, the first process is that patient servicing. So patient attending a hospital and based on his disease or based on the charges for the doctor's visit and medicine, etc., there are some collections which are made by the hospital authority. So patient servicing to collection is one mega process. Then procurement to pay, because hospital for providing such services to the patient or patient family, they have to procure. They procure medicine, beds, clothings, equipments, medical equipments, of course. So these are again covered under procurement to pay. Then there is hire to retire. Why hire to retire is so important in the hospital? Because the hospital consists of qualified doctors, some specialist doctors, and also some nurses who are also equally efficient and qualified. So getting such resources is not that easy. And also hospitals which are in remote places or hospitals in mega cities, there are differences. So getting proper resources in the appropriate places is also a big challenge. And the initial startup hospitals, there is another challenge of the pay structure because the experienced, renowned doctors, they normally will not uh, consider those hospitals which are in the remote places or where the full service providing will be difficult. So it is their choice also that which hospital they will attend, which hospital they will not consider. So for the HR department, hiring and getting the proper resources is also a big challenge. And retire is the normal course of action because in the old hospitals, the people goes out due to superannuation age. and some new or fresh blood is also inducted. So this is a process which is a continuous process like any other industry. But since it's a very specialized industry, like hospitals, they are getting appropriate doctors, appropriate nurses, appropriate persons is a bit challenge. Then it's a capital expenditure because every hospital, whether it's a startup or a old, always requires some new equipments. Suppose an eye hospital, they are having traditional equipments, but now all these cataract operations through laser activities, or there are different equipments, so for which they are supposed to make a budget. And some of those equipments may not be available in India also. Say cement, say for instance Siemens, the equipments which medical equipments which they supply, that sometimes may not be possible to get in India. So in Germany there is some advanced model, and in India there is some not that much advanced model is available. So again, their representative used to showcase the particular advantages for one equipment, and accordingly the hospital can ask for the ordering. Now for ordering, again, it is a capital expenditure, so there are certain formalities like they require a proper budget, they require the estimation that this particular equipment may cater to this number of people, and the fees for that purpose, and that which must be competitive one. Because again, for say cataract operation, somebody asking 1 lakh and somebody asking 5 lakhs and somebody asking only 12,000, there may be difference in quality, but that much price difference, justification for the same will be difficult in a competitive world. So one has to consider that also while planning the capital expenditure and capital budgeting. Next point is accounting. So accounting is a normal process which is for each and every industry. But here in hospital, the accounting is again something which is a bit different from the industry perspective. Why it is different? Because patient servicing, some of the patients are getting paid through insurance company. Some of the patient they pay directly. Some of the patient paid by the corporates because it is their patient, so they prefer to pay directly to the hospitals. So different modes of payment is applicable, and similarly there are different service areas in the same hospital, say orthopedic, say ophthalmic, say for the limbs and bones there may be another. So like that there may be 15-20 service providers, and also under each and every such service there may be uh, operation theater or facilities for operating the patients. So that is the area of concern, whether the appropriate billing is being done, and if the appropriate billing is being done, then whether it is accounted properly or not. So these are the basic questions which are relating to the accounting. Again, the fund management is a issue for any industry. In hospitals also, getting funds, sometimes it's there may be a part of that hospital is charitable, so where the free braids or free treatments are carried out. Now for those purposes, managing the fund and managing the donations, or the government, from the government they many a times get some share of expenses. So again, the fund planning, basically the timing, planning for the timing and planning for the volume, both are equally important. And the last point is the management information system. Any decision in any industry is depending on the proper management information availability and perusing those management information. Now here also in hospital, buying equipments, selection of equipments, amount to be spent on getting that equipment, the hospital service enhancement, whether it will be a multi-locational or it will be a single location from where the patients will be catered, number of beds, whether the bed number should be increased or the continuity with the same number of beds. All these are can be covered under the management information system and proper analytical approach. Because at the end of the day, everyone wants to earn a sizable amount of profit. So in the management information system, they can estimate that with increase in beds by say 10 number beds in a particular department, or maybe increasing 10 number beds in the general category, which one will be beneficial. So this type of calculations, this type of analytical activities are carried on in every sphere. So accordingly, the management information system, collecting the management information system and disseminating the management informations to appropriate persons or appropriate places is also very important for the hospital services. Now, all these mega processes are again subdivided into smaller processes. Like when you talk about the major process, there are sub processes also. So major or major process and sub process, whatever name you wish, you can give it. Now the outdoor consultation services, indoor services, general activities. So all these patient patient enrollment to patient discharge, or if it is outdoor, the patient attending the patient and after servicing the patient, getting the fees. So all these are important factor for the from the revenue perspective and from the hospital's existence perspective. Because if the patient attendance is very low, then a hospital cannot survive. Or in the short run, still they will try to survive, but in the longer run cannot be. You have just noticed maybe in the newspaper that there is one big hospital which is called Amri, which is under the Imami group. Imami, consumer goods. They are in the consumer goods, but they expanded some time back in the hospital industry also. Now that Imami hospital is being sold out entirely across India. There are many, it's a multi-locational hospital. They are sold to some other agency like Manipal. They have purchased it. So accordingly, this is also very important that how the planning for revenue and planning for the getting net revenue is being made. So insurance services, billing adjustment, payment received through insurance or TPO or direct payment by the corporate. These are the different modes available. So from which source they are getting the revenue and where is the shortcoming in the process by which some revenue leakage is also possible. So they are to ensure that the appropriate revenue is being recognized, the appropriate revenue is being received, and they are to ensure also that long-standing dues are not there. Because if a payment by a corporate is not coming within a specific period, then what is the process they should follow for getting the money in the earliest cycle, as well as also from the same can be applied for the insurance companies also. What for they are not paying the claim, or what stops the insurance company but for disallowing of certain expenses. So all these are to be in their radar. Now the patient transfer through ambulance and recovery, that is another service which is provided by many hospitals, that they have their own ambulance service. They pick up the patients from the respective residences for which they charge separately. So the ambulance requisition process, billing for availing that service, and also the operational aspect of the ambulances, because maybe they are collecting the patient from say 10 kilometers area. Now, whether the ambulance is running all throughout in different part of the city or village, but they are getting only 3 to 4 patients every day, and there is only one such vehicle is available. So whether that expenditure in running that vehicle and the collection made in this respect are equivalent, or it is expenditure is much higher. So then probably they may discontinue the ambulance service but they can provide it to another third party who can actually manage that hospital service. Like they can provide the number to the patient families, and they will directly contact the service provider. They will take the service and they will be paid to the service provider. So there are different models again the hospital should consider because of the revenue or for the profitability concerns. Now, again, the some of the hospitals provide the blood bank services, blood collection, plasma preservation process. This is in the hospital that must be a proper process because otherwise the bloods collected may be not in a usable condition. So in future, all these bloods cannot be used, and that is why they may face a huge loss. Then stock record maintenance for the blood preserved, and again the process of issuing blood therefrom at the time of operation or any other emergency requirement, they have to monitor it properly because otherwise the blood taken from that blood bank of the respective hospitals, the money spent on that may or may not be collected. So they have to ensure the full collection of the revenue in this aspect also. There are certain hospitals where medical shops are also maintained for easy availability of medicines and drugs. So these medical shops practically run 24/7. Drawals are made in the name of the patient based on the patient prescriptions. So they are to ensure that every such medicine which are prescribed by the doctors are readily available in the medical shop because otherwise there is no point in running a medical shop. People can buy that medicine from anywhere else. So why they will take it from that particular shop which is attached to the hospital. So again, ordering, receipt of medicine, doctor's prescription follow-up, delivery, that means the drawing for the from the hospital medical shop and utilization of the same for the purpose of the patient treatment, the stock record maintenance, payment receipting process for the medicines drawn directly by the patient or by the patient through hospital, then return of unutilized medicine, and also sometime the medicine's expiry date or validity that also has to be maintained through a properly maintained stock register. These ambulance service I have already covered just now. Then the other sub processes for the outdoor consultation services like this reception services to avoid patient queue because maybe there are certain good doctors, famous doctors, or very uh, critical for very critical diseases. Those doctors may be available for a certain period of time. Now within that time window, there may be enough patients and the doctor should be in a position, the doctor or doctors should be in a position to cater the requirement of those patients. And also the hospital authority should look into the aspect of the patient party or the patient relatives or for the patient, there should not be a big queue so that the patient may further, he may be the disease which may be aggravated also. So the reception services should be prompt and with appropriate system so that people can register at the quickest possible time. So token registration for diagnosis and different department allocation carried out from the reception, and that particular token, with that particular token, the patient or his relatives can visit to that particular in-house facility where from they can get it without much of delay. Suppose they want blood, so a blood coupon will be issued and that coupon will be taken to the blood bank inside, and the blood bank inside will bill it for and also hand over the blood to the patient party, or they may directly send it to the bed of the patient where it is actually required. Even for the same is applicable for the medicines also. Then they are to schedule the doctor's visit because as I said, the good number of doctors and good doctors, they are really they don't want to visit many hospitals, or there may be time slice, a particular time slice they are available in that particular hospital. So scheduling the doctor's visit at a very, very preferable time frame. That also has to be looked into, because if a doctor visit time is 11 o'clock in the night, can you imagine that there will be any patient? So that way, the timing within the daytime, that should be time slice should be made in such a way, and even there may be five good doctors for five diseases or maybe two diseases, then all the five should be rationalized in such a manner so that on the same day there should not be more good doctors. So it should be like this, that one good doctor on say day one, another on day two. So like that, the schedule of the doctors also should be such so that the patient party can visit any one of them, and the hospital authority is not losing any patient. But if it is on the same day, so everything there will be huge rush, but on the other days there will be no rush. So that again, depending on the situation, the best foot forward to be considered for the purpose of the specialist appointment. These doctors are the specialist doctors, of course, because they are the good and probably the best in that area. So accordingly, their time slot should be fixed for the patients. Patient allocation to doctors, aligning with doctor visit schedule. So because say some doctor may coming on the Tuesday, and the next visit will be again on say Sunday. So the patient should be advised, if a particular doctor is attending, that look, today is Tuesday and your next schedule will be on Sunday. So and accordingly the doctor, the same doctor will instruct the patient that he is only available on next Sunday. So accordingly his patient party should be advised to visit on that particular date, because otherwise the same doctor is not available. There may be other doctors, but some patients having a fascination for a particular doctor, and maybe that doctor is the best doctor in the locality. So all these scheduling of doctors visit, allocation of patients is also very important, because a satisfied patient may create more customers for the hospital authority. Aligning with patient token, which is already registered. So as per token, the patient will be allotted, and there is some announcement system. And mostly in big hospitals, there is some announcement system that take token number 58 may be aligned with the heart specialist. Token number 59 may be in the ophthalmic department. So like that, when the token is registered in the microphone, if it's a common place for the waiting place for the patients, that should be announced in such a way that the related token number, the person who is holding a particular token, he can visit to the doctor without any difficulty at the point of time when he will be called for. Then the billing against patient allocation and collection, again, it can be through cash, it can be through credit card, it can be through debit card. But in any case, the billing for the appropriate service enjoyed by the patient, that has to be made correctly. Because suppose a patient is a heart patient and his cardiac treatment bills is not being raised, or it is raised in the ophthalmic department, so there will be total chaotic situation. So to avoid all this, the patient token to be aligned with the billing system so that the billing appropriately can be made and the patient can pay the amount, whether it is in cash or by through debit or credit cards. Rendering the above services, delivery of report and fees collection by respective units, because you know that when the blood test or some typical tests are being carried out, they are supposed to provide the report. The patient, after all this test, submission of tests, they will carry the same token and the bill, and after submission of the bill, they will get the requisite report from some other counter or maybe from the department counter, and that instruction should be very clearly made, and also the report handover time, so that the patient or maybe his relatives or patient party, generally it is called, so they can attend the same time when the report will be delivered. Suppose a normal blood examination, Now the reports are available overnight. That means on the same day in the evening. So accordingly, they will be instructed so that they can collect the report within the specified time. And now in some hospitals also having the mailing facility, if a patient having a mail ID, then they can also forward it to the respective mail IDs of the patient or maybe his relatives. The pantry services are again provided to the outdoor patients. Sometimes the waiting patient's family, they also can enjoy the services of the canteens. So the pantry service or canteen service, it is against the billing, and the billing is done by at the particularly at the center where from the foods are delivered or where the canteen service is available. So take and pay for outdoor patients, patient relatives or visitors. Tariff fixation and collection for over-the-counter sales made. So there will be fixed rate which is applicable for all. And also the patients are provided food at their bed also from this facility. So number of food, and maybe there are some dietitian who is giving a specific food to particular patients. All patients may not be the same food prescribed. So there are different food is prescribed to different patients. So based on their prescription, the special food reaches the bed, and also accordingly the internal charges are being made. By internal charges, what I'm trying to mean is that the patient of a particular disease, say given some soup or some other items, so based on that, the recovery of the canteen facility will be made because each provided the each such service units are a profit center. So at the end of the day, they may know that out of the food service through canteen, how much money they make, and that charges should be reasonable so that the patient party, if they also wish to enjoy any of the foods from this canteen facility, they can also have it at a particular cost. Now, in the indoor care services, there may be different type of beds, which we normally call. That is also possible. Say a private room, which is called cabin, semi-private room, where maybe two beds are there, the cabin consisting two beds. Then there is general ward. Then there are ICU, intensive care unit. Then there are incubators. So like that, there are many specialist room as per the choice of the patient that is also available. Now, each having a different tariff schedule. So when a patient may be the transfer to ICU, so from that point of time to till release from the ICU, that particular rate for the ICU will be charged. So tracking this is again a very important factor. Otherwise, the higher charges facilities will not be charged. The rate higher will not be charged, whereas the charge for a lower rate can be made wrongly. So this following up of the time, and sometimes maybe the patient in a say semi-private room where the tariff is half of the private room, that time the private room was not available. So the patient compromised and asked for the semi-private room. But as soon as the private room is available, he or she should be shifted to that room so that the higher billing can be applied on that particular patient. So there are different services for which separate billing module and separate tariff charges are applicable. So accordingly, that should be aligned with the patient token and the services actually available or availed by the patient in course of his stay in the hospital. So there are again other sub processes like ordering based on approved requisitioning process and its approvals, inventory at hand, inventory ordered, prevalent consumption level. Based on that, the future orders can be monitored, maintenance of item-wise inventory level, approval for staggered delivery and scheduling, then goods and services acceptance based on the quality assurance. Because again, the particular services, whenever asked for, that must be with the proper approval of the quality. Suppose you were asking for thermometers, but the thermometer is not working. Should you accept as an hospital? Should you accept that? Certainly, answer is no. So there is a testing facility where it will be tested to ensure that yes, the thermometer is in proper condition and it is the thing which they asked or ordered for. So accordingly, quality approval is a very important factor, even for the artificial limbs. All these, the quality assuring or assurance of quality is very important for the from the point of view of the hospital's quality and service quality. The inventorization process, physical custodianship, issue procedure and balancing, physical verification and authorizations, short or excess adjustment with financial impact, or agreement with different agencies and approval therefore for different grades or variety of services, agreement with artificial limb pacemaker suppliers, receipt and payment process, contractual obligations, storage cabins, appropriateness and physical accessibility, custodianship, all these are very, very important for the hospital. The storage space again is a big issue for any of the hospitals. It should not be damp. The area should not be damped. The area should be properly maintained so that the medicine quality can be maintained. Because if there are, say, white ants, now white ants can destroy the outer cover of the medicines also. So like that, some medicines are instructions are there on the, you may see that keep in a cool, dry place. So that has to be adhered to. Or maybe in some medicine it is written that avoid sun rays. And so the room conditions should be such that this sort of obligations with respect to keeping of medicine can be observed. Then doctors, patients, nurses, there are separate dresses and gowns, which is again to be ordered on timely basis. And also the sizes, because the any human being, all human beings are not identical. So there are different sizes for the fat people, tall people, short people, all these different length and breadth materials to be ordered so that it can make the patient or the doctor a bit comfortable, because otherwise uh, a misfit gown or a misfit dress may create problem during his work or during his stay in the hospital as a patient. So one must ensure that again appropriate quality, appropriate size, and the numbers which are required as per the utilization in the previous period or their trend of consumption, it should be considered before ordering for the next lot of materials. And also the lead time, like any other purchase processes. Remuneration to doctors, specialist on call, nurses, front office people, all these are again as per the approved pay structure by the HR department. And any doctor having some special pay, etc., that also to be looked into, because maybe a doctor who is pulling the maximum patient in the hospital. So if that doctor leaves that organization, then the organization will face loss of patients. So accordingly, all these things to be taken care of by the HR department in course of its hire to retire planning, so that the appropriate doctors with appropriate pay, nurses with appropriate pay and appropriate service ability should be selected for the hospital services. Office maintenance, staff and contracts, on-roll or agreement with agencies, permanent deployment as per ward department, attendance data, capturing and verification of service quality, roster duty maintenance, because there are certain doctors who are good doctors and accordingly they cannot attend 24/7. So there's a mix and match of good doctors during night, during day shifts, so that ultimately the hospital's objective to provide the best quality service to the patients is possible, and also the doctor who is again a human being, he should also get the amount of rest, the amount of relief which is required in attending the patients simultaneously or at a time slot when it is required, so that all the scheduling is very important for the doctors also. Again, the major processes hired to retire includes that manpower budgeting, employee joining, onboarding process, duty roster, local and other travel reimbursement, employee separation and exit scheme, statutory obligations, adherence to the statutory obligations. All these are very important for the HR department in the hired to retire process. Then again, there are certain statutory services like patient birth registration, newborn from the gynecology department. The process should start, and at the end, that local municipality or the local authority who is issuing this registration certificate to cognize newborn's date of birth. So all this facility should be there so that in appropriate time with less hazards, the patient can get the certificate for the newborn and without any difficulty. So that is again a service which is provided by the hospital having these gynecological departments. Then the hospitals have to have a dress code. The doctors and patient, it should not be the same dress or same dress code. Doctors having some practice of using particular colors. So those colors to be used irrespective of the nature of the doctor or the hospital. And also for the patient, there are certain ease to wear gowns or ease to wear clothings of appropriate color, not same as with the doctors or nurses, that should be produced. So limb, eye donation before death and legal implications, obtaining mandate and legal guidance. Someone can donate these things, the limbs, eyes, etc. But collecting that with much of difficulty at appropriate time, that has to be ensured in any case, because otherwise that limbs which are going to be collected, that will not be of any future use. And again, general staff and HR related activities to maintain the industrial peace, harmony, and good relationship among staff, doctors, nurses, and patients. That has to be a big challenge for the hospitals, because in a very small issues, there may be quarrels, there may be problems with the nurses and doctors. That has to be kept as much as in the low level as possible. And that is possible by the good human relationship maintenance, and where the HR department with appropriate training, appropriate behavioral teachings or trainings, they can again imbibe such a culture, so that since it's a very separate type of activity where service is the motto, so that people can get the appropriate service without any agitation in their mind. Then again, approval process, sanction and budget, indent receipt and review, floating request for quote, vendor selection, negotiation, release of order, PO generation, release of advance with delivery schedule, inspection of material delivered, stores accounting, fund management, capitalization of fixed assets. Again, in the under the accounting, this thing actually comes because when they have the budget for the procurement of the equipment, it must be procured on timely basis. And again, then capitalization, there's a process, payment for the equipment purchase towards vendor, invoice verification, debit notes or credit notes, voucher approval process, approval for payments. All these, like any other industry, is important here also. And also for capital equipments, if it is imported, just I mentioned that Siemens may not be in a position to deliver it in India. So they may ask for import it from Germany. So in that case, again, the item should be brought from Germany with a proper import billing and import process. So the adherence as well as the timeliness, both are very important in this respect. Then again, the payment procedure, whether it will be paid through foreign currency or local banks, bank guarantees, etc. These are also very, very important factors. Now, the timely accounting, timely reconciliation between different accounts, bank reconciliation statement, any approval for a special treatment, suppose for the some high ticket, big ticket, or maybe some very, very influential patient, something extra which is required and which is not normally available in the hospital. So in that case, again, there should be a special approval process through which that will be ensured that the particular item is being provided to that VIP patient, and accordingly the payment etc. to be released. So there are, as I mentioned earlier also, that fund management, timeliness of getting the fund, approval for the expenditure, fund flow monitoring, surplus deficit from the different activities. Activities means here different activities for the hospital services like ophthalmology, then say gynecology. All these departments are appropriately funded for their equipments, and also the revenue which is generating from the new equipment. There should be again an MIS, or there should be appropriate monitoring for the same surplus or deficit with reasoning, break-even points for different activities, so that whether the continuity of the same in the future will happen or it will be discontinued. Then there are different government schemes where from they get money, like Shastro Sathi Yojana in different states it is there, or maybe PM Swasth Yojana. All these again the funded by the government. So appropriate steps need to be taken in case of the government fund is coming, how the government funds to be spent, appropriate recording for the same, and also there to ensure the adherence, because if the fund is coming for a particular treatment, say tuberculosis treatment, so that fund should not be diverted to any other treatment. So like that, there to ensure that the funding for the purpose which has been made, the same being adhered. And again, from insurance company receipt, overall budget, net cash flow, and monitoring of the same. These are very, very important factors. And the last is that management information system, which I told already that it will actually involved in the decision making process. So how the best information can be considered for the best possible result, the different dashboards, different timely publication of different data, which will influence the right decision. So all these are, like any other industry, is a process to be adhered in the hospital. So I have discussed in detail because whether it is a hospital or hospitality, in any of the areas, the work should be such that there are a number of points, as I mentioned, say almost half an hour we continued on the same sort of discussion. So here again, the main which I want to point out is that you have to follow the process. You have to highlight the major points where by which you can get higher score. Now we are from hospital, we are shifting to hospitality industry. It is again a case study. Here, a CMA club members with their family visited a resort at Goa. The resort is well equipped with all sort of modern facilities like golf course, tennis room, spa, health club, swimming pool, library, bar, coffee shop, food lounge, etc., etc. All and different cuisines, multi-cuisine restaurants. So members and their family have well selected facilities. The team settle their accounts before leaving the place. Discuss about internal control and review of hotel collections. So now you are to dish out the process gaps, how to pick up those process gaps, and how to ensure that these process gaps are not happening. So the control measures are such that there is no revenue leakage. So the room sales and cash collection is a process where you can see that grade wise, ordinary room, luxury room, super luxury room, all these rooms with different tariff, room tariff and booking as per front office, and verification with billing desk to ensure appropriate billing for the room nights. Because there are a number of families And also maybe some selected they are the super luxury room, some may be luxury, or maybe it's a package. So it depending on that, the tariff schedule is being made for the particular this CMA club. Accordingly, the charges are to be made. Then room services like food, drinks, laundry, minibar, fridge kept inside the room with food, drinks and beverage. That is actually called minibar. So consumption out of that minibar, sports facility usage, etc. recorded and billed appropriately for collection. So there, to avoid the possibility of any revenue leakage. There are various sales points scattered in a hotel, and sales are both for cash and credit. The control over cash is very important. The charge for room sales is made from the guest register, and tests are to be carried out to ensure that the correct number of guests are charged. So as it's a CMA club, some member may be having two kids, some member may be only traveling with wife and husband, some may be with some relatives also. There may be 7 or 8 number. In total, there will be for this club special tour. So they will count the number of heads, the rooms. There may be two kids, but it's a double bedroom only. So kids are not charged, but the food, etc. for the kids, which are served whether at the room or at the restaurants, those are to be signed off bills should be collected so that nothing can be at free of cost. Before leaving, they have to ensure that everything is being billed for. Credit card or debit card, cash, foreign exchange, check, RTGS, etc. to be tallied with the bill value, because before leaving, they have to ensure that all services are billed and the money which is paid by the tourists via credit card or debit card, cash or foreign exchange, or for corporate booking, since it's a CMA club, maybe there's a corporate booking. So the check to be collected upfront, and immediately that can be the facility of encashment should be there. And so the nearby bank can they can collect it before actually they leave the place. Or maybe if the arrangement is like that, within 7 days it should be paid. And it depends on the organization to whom they are extending this credit facility. Next is the daily room occupancy report. As a part of MIS also this can go. So check-in, check-out time and billing for the occupancy to be validated on daily basis. So total sales reported with the total bills issued at each sales point have to be reconciled. Then again, the food bills, kitchen order token, signed customer copy as evidence for consumption, that has to be collected at the billing point, so that all the facility charges enjoyed by the tourist team are being considered for billing, and accordingly before leaving the bills are to be settled. Receipt and payment verification, consumption shown in the physical stock accounts must be traced to the customer's bills to ensure that all issues to the customers have been billed. All payments to the foreign collaborator, if any, are to be checked. There are certain hotels like Hilton, etc. They have ITC with Sheraton, like that. They have arrangements with their foreign counterpart for the best services. Now, these collaborators are also to be paid from the hotel authority. So again, this is a point which also to be checked as an auditor, that not directly related with the any of the this CMA club billing, but it is overall it is connected, because the number of guests, the charges are levied normally based on the number of guests attended. So they are to collect that information and they are to pass on that information for paying appropriate royalty. Expenses and receipts are to be compared with figures of the previous year, having regard to the average occupancy of visitors and changes in rates. So this is very, very important, because these MIAs will help the management in fixing the future rates, because some rooms may be under recovered. Some rooms may be in the similar facility in other nearby hotels or in the same grade. Grade means 5-star, 3-star, 7-star. So in that star gradation hotels, if one room of 7-star facility, maybe it is 20,000 per room night, And in this hotel, it cannot be 2000 rupees per night. So the parity should be there. And accordingly, this study will help in maintaining a parity nearby. Maybe if due to place there is some maybe over or under charge can happen. Say like ITC Grand Maratha in central Mumbai, that charge with ITC Sonar Bangla in Kolkata may differ, but that should not be say 70% or 65% over under difference. Because if the facility is 7-star, then at least maybe the charges differ 5 to 10% because of the location or locality, say Bombay in central or Calcutta central. These are the locality wise, these are different. So maybe or maybe certain facilities, say maybe the Bombay hotel is a 1 mile golf course, but Calcutta may be having 10 miles golf course. So that is again a differentiator for which maybe some extra charge can happen, but it must be justified. So within the starts, even if there is a huge rate difference, that has to be then to be justified. In-depth check should be carried out on the customer's ledgers to verify that all charges are being made properly and recovered also. The company rate should be worked out. For the corporates, again, they get some special discounts or special rates because they have the most frequent passengers or most frequent visitors to the hotel. So based on that, their charges could be different. Then expenses for painting, decoration, renovation, building, etc. are to be properly checked. Apart from control over stock of edibles, control over issue and physical stock of linen, cutlery, crockery, glassware, silver items, etc. also to be verified, because any miss of a silver plate or maybe a high value equipment will create a loss for that particular hotel, and also maybe service disorder, because such things may not be in plenty. So silver plates are available maybe 100, but if 10 goes off at one go, so getting the similarity of with the other 90 maybe another point which again to be considered, because if you ask for a smaller order, a smaller quantity, the price may be higher. You have to pay much higher price to the vendor. The auditor should verify the restaurant bills, KOT, etc., so that appropriately foods are delivered. And whenever a particular quality of food, say whatever be the type of dish, that as per that dish, the items required, that also has to be checked so that that items are used in the appropriate. Because in most of the good restaurants or hotels, the volume is again fixed. A particular dish weighing say 250 grams. So 250 gram consists of these items. So they have to ensure that more or less nearby that appropriate weightage was supplied, and the ingredients are also used in the ratio which is or near to the ratio which is all specified. Computation and payment of salaries, wages to the employees, whether they are temporary. Normally in big hotels there are no temporary staff, but in smaller, yes, it is possible. So temporary and permanent, the register to be maintained separately, and also they are to be paid on time, because in hospitality industry, the any dissatisfied soul in the employee may create problem in the relationship with the guests. Then stock of utensils purchased, housekeeping items, or etc. There should be a stock register, and from time to time this physical availability and physical condition. Mostly the important point is physical condition, because in 5-star hotel nothing is acceptable. Suppose a cutlery, crockery with a little bit of crack in the say cup or in the dish, which is not at all acceptable. So one has to ensure that they are in proper conditions, they are in appropriate numbers are available, so that you can maintain the or validate the stock register with the actual or the reality. Now, there are certain other points which may be noted, that food procurement and issue to kitchen, again another control aspect. that everything whichever is purchased or delivered by the vendor are not immediately taken for consumption. Yes, it can be, but the appropriate weight or appropriate measurement which is paid for is going to kitchen, and from kitchen the foods which are prepared is almost nearby to those ordered for, because otherwise what can happen that the material which is procured is not used. Maybe it has been gone out by any process, unauthorized process, or maybe it may so happen that they are buying in such high quantity which is not required to cater the requirements of the customers or the visitors, travelers who are in the hotel. So again, there will be a problem. So they normally monitor it, that what has been considered as in, almost the similar is going out as by way of consumption. So storekeeper is responsible to maintain the stock area clean as much as possible and to justify the stock at hand with appropriate receipting and supply to the respective departments there to ensure appropriate process and appropriate documentation for the same. Unauthorized person should not be permitted in the storage area without specific permission. Many hotels are specialized in professional valuers. They appoint professional valuers in this aspect to get the proper idea that this much material is there, and also the condition of the equipments, condition of the cutleries, crockeries, cartons, etc. are just that quality which they require. Again, that can be done through a proper methodical physical verification process, which is documented and certified by appropriate authority. There may be a fixed asset register because very costly furnitures and fixtures are there in most of the high grade hotels, and it's a resort hotel. So there may be different, saying that they have the spa. So there are different machines are also there, and those who are in the working condition, because that's also very important, because otherwise it will create dissatisfied customers, because someone if want to enjoy the service of a spa, but after visiting there he may find that half of the equipments which is required for hair treatment or for the body massage or for other particular purposes, they are not working. So keeping the machines in appropriate working condition is also a necessity for such high grade hotels. Then section wise, cost center wise detail of manpower deployed, manpower actually required, then maintenance spent, wages, etc. to be recorded, and analysis should be carried out so that whether any movement means higher than anticipated or lower than which is supposed to be, create a sensation that how it is happening with appropriate analytical skill, so that if there is something going on which is wrong, that can be rectified at the earliest. As I mentioned, that casual labor is a rare phenomenon in the star hotels, but even some cleaning operation, etc., even if it is outsourced, a proper time booking facility along with the certification for the job with appropriate quality. Say swimming pool cleaning. Swimming pool cleaning is being outsourced. So those agencies are coming at a frequency which is prefixed. They are doing it when the swimming pool is open, and also with the appropriate medicines which are used for treatment, so that the swimming pool can be in a proper functional in the organization. The wages payment of the casual labor, that also has to be checked, and overall the cost and revenue comparison facility wise, so that if it is required that some facility is not giving profit, some facility, say golf course, there's a good golf course, but the golf course is not giving any revenue. So people in that hotel who are coming, maybe it's such a hotel which is for the office jobs. People, visitors are mostly the office people. So it is not a resort. So golf course can only be used in a resort. But if it is not a resort type hotel, it's just a official hotel. So they are having a golf course without any revenue is of no point. So they can consider such services which are not giving any positive revenue, which may be decided for discontinuation. So this sort of decision, again, depending on the proper maintenance of accounts and proper maintenance of MIS, and accordingly they can reach to the correct decision. And now I'm coming to the another sort of organization, which is educational institution. In educational institution means all of us are quite accustomed, just like our ICWA or ICMAI is also an educational institution, but it's a professional educational institution. And there are other educational institutions like different colleges, schools, etc. So for them, there are certain important points which I am trying to mention you, because which again, as a part of case study may come. So the general consideration is that the document relating to the formation of the institution, like this point I have not considered in the hospital, which again this point can be considered there also, because there are, what is the uh, organization structure of the hospital? It's a hospital private, is it a hospital is again a joint venture between the state and the private authority, or it's a hospital under the municipality, or it's a hospital which is state owned. So the different organization structure is ultimately will drive certain points. So here again, the educational institution also it is applicable. So documents relating to formation of the institution, affiliation. So it is a CBSE, ICSE, or it's IIT. And if it's IIT, then it's affiliated to which IIT. So there are different organization structure and also the management structure. Some having a governing body, some having a educational council. So all these depending on the organization structure. Now assuming that or there are different organization structures. So again, and there are different weapons or methods through which they collect the fund also. So there may be in a government organization, it's the government is sponsoring the full payment. I mean the fund. Sometimes it's a private, so they go for donation. It's a co-owned government and private. So there again donation, there may be government subscription, there may be affiliation fees payment to different universities. So these are again not specified. So when writing these type of question in the examination hall, first you are to say that I am considering the following. Number one, it's a trust or it's a organization under private ownership. So that will again elaborate or culminate it into certain points that which are the regulations which are applicable. If it's a trust, then of course the trust deed should be there. If it's a private partnership, then the partnership deed has to be there. So like that, there are different type of organization. If it's a company, corporate hospital like Apollo's. So if Apollo is a corporate hospital, then Companies Act, the specific regulations under Companies Act are applicable. So like that, you have to select that organization, then it will be much more meaningful from the funding, management style, management type, the expenditure authorization. All these again will hover around that particular type of organization. The approving authority for the expense, fund transfer, bank account operation, read through the minutes of the meetings of the managing committee or governing body, noting resolutions affecting accounts to see that these have been duly complied with, especially the decisions as regards to the operation of bank accounts and sanctioning of expenditure. Then again, there are different in the whether it's a degree college or whether it's a university. So in degree college, it's undergraduate. So there are different semesters. And again, as of now, the new educational policy. So in the new educational policy, how these semesters are being applied, what are the subjects? Because in a particular semester, in a particular stream, say if it is considered as commerce, there are different subjects. Out of that is not necessary that everything to be considered. So a particular college, undergraduate college, they may consider in the commerce 5 papers. The other maybe another 5 papers. So like that, whether the minimum number of papers or options given to the students or not. So that is could be one area, because ultimately the fees collection depends on the same. Having a multiple courses available, the possibility of getting number of students and also the fee structure, variable fee structure is possible. But when there are only few choices, so students may not prefer to go there. So again, this is an issue which you have to describe in your uh, aspect in the examination, because otherwise you will get a general marking. But if you provide very, very specific that that is why I am considering this, so this will bring more clarity for the examiner, and also your answer will be the perfect answer. Now then again, student name, address, Aadhaar card, guardian, etc. The details. These are required for student admission and your database, so that in future if any question comes, you are in a position to answer that. Where collection through direct banking takes place, the bank statement to be equated with the fees receivable, because ultimately an organization or educational institution survives on the fees collected from the students, unless and until it's a free education system where students need not pay anything, or maybe they are paying a very token sum, and rest is either collected through government donation or through some other, say it's a foreign, is a university having affiliation with the foreign counterpart. So probably to advance education in India, they are giving the entire money, and especially there are research institutions who run in this model. So research organizations are also a educational institution which basically run on such model, that German university sponsoring some courses in India. So they are paying for the students' expenditure under those courses which are registered. So accordingly, depending on the situation, there is nothing called that the answer is sacrosanct. So if the way you think of, the way you produce it, but you have to have a justification. Check admission fees with admission slips signed by the head of the institution and confirm that the amount collected is appropriate. The free studentship and concessions have been granted by a person authorized to do so, having regard to the prescribed rules. Confirm that fines for late payments or absence, etc., have been collected, unless it is condoned. It can be condoned also, because maybe the principal of the institute having a condonation power. So you just look at when the lesser amount is being collected or no amount, say students are discollegiate. Now there's a discollegiate fee under that university's rule. But here in a particular college, these are not collected. So if it is not collected, then college has to pay. But that decision has to be taken by the head of the institution, and which should be recorded, so that when the auditor will audit it, he should not, or he or she should not raise any perturbing question that why the amount is being collected lesser than which is anticipated. So the answer is that the proper documentation approval from the head of the institutions, that look, we are condoning the students and their fees will be paid by the college before sending up for the university examination. So that's fine. So that sort of recording should be there, so that any deviation from the practice, from the AICT rules or from the university rules, that deviations can be marked, and for those deviations, the appropriate authority level approval exists. Verify the inventories of furniture, stationery, clothing, provision, and all equipment, etc., because nothing is being taken out without the permission or without the knowledge of the people, so that appropriate checks and balances are in place and there is no difference or shortage of the material which are supposed to be there. So vouch income from endowments and legacies as well as interest and dividends from investment. Also inspect the securities in respect of investments, because if you can remember in Satyam, the famous Satyam debacle of Mr. Ramalinga Raju, there these fixed deposits are Xerox copies of fixed deposits are being maintained as investment, and original fixed deposits are already being encashed. So here again, the auditor should take the original investment papers, even if it is in the bank custody. Sometimes the organizations keep those things in bank's custody. So an original letter officially stamped by the banker or by the authority where these certificates are being kept, that has to be presented so that it can be ensured that the certificates are in existence and it is kept under the custody of such and such person or such and such bank. Verify any government or local authority grant with the relevant papers of grant. If any expense has been disallowed for the purpose of grant, ascertain the reasons and compliance thereof. Review of recipient payments, income and expenditure for completeness and accuracy. Confirm the caution money and other deposits paid by students and admission have been shown as liability. And and also when this period of their course is being over, then the caution money refunds are made as per the request made by the student, duly approved, duly considered, and the payment been made. So that the caution money account or caution money ledger that can be appropriately examined with the only with the live students, and also the students, the ex-students who are not opted for the refund till such time. See that the investments representing endowment funds or prize fund are kept separately, and any income in excess of the prizes have been accumulated and invested along with the corpus. Verify that the provident fund money for of the staff has been invested in appropriate securities. Vouch donations, if any, with the list published with the annual report, if some donations are meant for any specific purpose. See that the money was utilized for the purpose. Then again, the capital expenditure to be vouched, because it's an educational institution, so maybe laboratory equipments, library books, almirahs, and also the whiteboards, tables, chairs, these things can be purchased, so that should be appropriately supported by the vouchers. See that the increase in the salaries of the staff has been sanctioned and minuted by the committee. Ascertain that the system of ordering, inspection on receipt and issue of provisions, foodstuff, etc. It is applicable for the uh, students' hostel facilities. So also educational institutions sometime having the hostel facility. So they are to monitor the hostel expenditure, hostel spent basically, and the spent is basic for the purpose of the students. So number of students staying in the hostel, expenditure per head, if there's any recovery clause for the same against the same, that recoveries are being made from the monthly student fees, all these are to be ensured. Verify the annual statements of accounts while doing to see the separate statements of account have been prepared for the Poor Boys Fund, Games Fund, Hostel Fund, and Provident Fund of staff, etc. So this is again an organization where we have made what are the typical points which may come, because a hospital having a difference with a school or an educational institution. Again, there are different structures in the organization. As I just mentioned, the school or college may be governed by trust. Maybe it's a government institution. Maybe it's a private school. Maybe it's a jointly private and government funded school. So like that, this depends on certain specific points. Now here also, if you see the slide, the different types of organization. So organization type wise also, there are different audit checkpoints. So a cooperative, and this time in the 2016 examination, no, in the new course, sorry, not in the 2016, it is in the 22 syllabus, new syllabus, which is applicable for you. This cooperative, how the collection from the cooperative is being made, a sort of question was like that in the case study part. So typically these questions are the organization structure, because different organization structure having different checkpoints. The same cannot be, it's not a panacea that same medicine is for all the diseases. It is not. It is actually specific medicine. So if it's a body corporate, certain points are different. It's a partnership, some points are different. So cooperative is again a form of organization. Now within the since this question has come, I'm thinking that I should also deliberate on this typically, so that in future you can remember all these things, since you will get very soon the suggested answer also after publication of the result. So in my opinion, like this, the cooperatives, there are different type of cooperatives. It may be a cooperative, say Amul. Amul is specifically for the milk cooperative. Banaskatha cooperative, again a milk cooperative. There are agri-marketing cooperatives. There are typically cooperative banks. There are typically housing cooperatives. So there are different type of cooperatives. Now collecting debts. So first question is how the debts emerged. The debts can be emerged for, say, number one, housing cooperative. So you have given loan to buy the house in that society. You have installment EMI, and EMI having a specific period within which it's supposed to be paid. And the society having laws or bylaws that if it is not paid within specified times, one or two installments may be condoned, that can be delayed. But if it's a perennial type, should we have a clause that after 10 installments, if it is not paid, then whatever has been paid will be considered as not paid, and your ownership right in the cooperative, you will lose the right of cooperative. So can it be there? Provided it is there, then you have to make it a very typically in the your organizational. Just 1 minute. হেমন্ত তো গ্যাসের কাজ করে না যতদূর জানি। তো তপন দা এগুলো এক্ষুনি বলে কি করে? এখন আমি ক্লাস নিচ্ছি, এখন আমি গ্যাসগুলো আমি 0.5 ঘন্টা পরে ফোন করছি আমি, প্লিজ। তাহলে চলে যাও যেখানে খুশি। Educational organizations, again similarly, the organization structure, that what sort of organization it is. It's a private educational institution, it's a government organization, or it is in the co-method, it's partnership of government and private. So what sort of educational organization it is? An educational organization may be for the graduation, undergraduation, specific courses like IITs, like medical institutions, medical colleges. So again, within the organization structure, there may be different organization management structure. Now, all these actually influencing the type of audit. So coming back to again to the cooperatives, that what sort of cooperative it is? It's a marketing cooperative. It's a marketing cooperatives, then what product are supposed to be marketed? So why the debt has been pestering or creating problem? Because debt collection is the agenda which you are supposed to answer. So this marketing cooperatives may be the crop failure. That crop failure has made the position like this, that the members, the farmer members, not in a position to pay the money. So similarly, the non-governmental organizations, the NGO, They are typically in different sector. Some NGOs, they are providing school facilities. Some NGOs, they are in the maintenance of the greenery. Some NGOs maybe for again for the street beggars. So what nature of NGO it is that drives the your internal auditing points based on the organization, the function of the organization, and also the fund requirement, which are the general points. I'm just touching upon those points. What is the fund requirement? How that fund is being generated? How the expenditure being made? How the approval for the expenditure being made? So like this, one has to answer one by one the queries. So while these questions are being made in the examination, one must be very sure that the educational organization or the cooperatives or sole proprietorship organizations or government organizations, NGOs, non-governmental organizations, local bodies, the common pointers is that what is the organization structure, how the management of fund being made, how the expenditures are being made, the purpose of the organization, how the purpose being fulfilled. So like this, you are to encounter this question and deal such questions. So that will give you at least a better marking in the examination, because it is not possible to, because in the study material there may be 18 such organizations are being mentioned. But the question may be on one or two, which is again eyeing to some typical, just like in a cooperative, debt collection. So debt collection is only one function of a cooperative. Now, what is that nature of cooperative? That drives the debt collection, because how the debt has emerged. So milk cooperatives, debt emerged of the milk cooperative is something, agri marketing is something, and normal cooperative housing society is again different. And also from the cooperative banking facility is different, cooperative banks. So you are to ensure what type of organization, what for that debt has emerged, how that debt can be managed. Collection is the ultimate aim, but how that collection can be made within that organizational system, what are not there in the documentation which can stop you from collection. So these are the typical things in the agenda which are to be dealt in the questions. So whatever will appear in front of you, you are to address those typically from what I just discussed. So some important tips for IA in different organizations, the documents for clarity of organization structure, type of what I said actually, now you are finding on the slide, the documents for clarity of organization structure, that is type of organization, legislative bindings governing laws with respect to the organization, organizational guidelines, management and structure for daily regular activities, authorization and supervision, organizational goals, authorized persons to carry out and approve the activities, alignment of activities with organizational goals, objectives. What I discussed is everything is here, but if you can remember these steps, then whatever be in your examination, you will be able to answer this. It's a tips from my side, which you remember. Similar cases with this time it has come cooperative. I don't know what will come in future, but this will help you in answering and getting good score. So activity wise, internal control structure, internal checks, accounts, evidence and records pertaining to support accounting, assets, procurement, physical existence, movement and maintenance, payable liabilities and payments, recoveries, scheduled and actuals, timeliness and actions of accounting recognitions, review and monitoring process for organizational activities, compliance status, all these are to be dealt. If you address all this in any form of organization, in any way, that it is debtors or making payment. This will help you, no doubt. So please remember this chart so that you will be able to answer the question. So I'm at the end of this 14, 15, 16. In future, if I get time, I will try to provide more coverage. But now I'm going back to the costing side, because ultimately within a span of 4-5 classes, I am to cover the entire, I will try to cover all the entire course. Uh, in considering the time and syllabus, it is difficult, but I'm trying my level best. So here it is, the time left is around 35 minutes. We are at hand, and I will try to finish this, because here everything is in your books, the CAS, cost accounting standards. But what I did is I just methodically presenting it, and you can also uh, go through in same fashion. That will save your time, energy, and also you can appropriately answer the questions, because there are from the old course also it was there. So you can see the questions what appeared in the examination. Of course, in the new course, it is just you will get only one term question, but still you can have the idea that what sort of questions may come and whether these will help you in answering those questions. So classification of cost, again, the basic objective of any of the cost accounting standard is uniformity, consistency, application of principles, classifications, and also in the presentation. These few words, if you remember, any of these CAS you can deal, because you see, ultimately the object, what is the objective of this CAS? Uniformity. So any of the CAS eyeing in the same thing, uniform treatment, consistency. So last year I have one policy, this year again another one, future year I will make another one, previous to previous year another one. So it is inconsistent. So consistency is one of the major issue which one has to maintain. In the principles of classification, whether it's the principles of classification or methods of determination of capacity, everywhere the consistency is required. So for passing the examination, just like one has to consistent in its studies. It is not like that just 2 days before the examination, you started reading and you passed. Not that case. So you have to consistently read. Similarly, any CAS, eyeing at that, you should be consistent. Consistent as to which respect? In disclosure, in treatment of that particular area. So you want to determine your capacity. Last year you determined in one way. This year you are going to determine another way. That is not good. So you are to be consistent. And it must be appropriately disclosed also. If you change, suppose inventory valuation policy, you have changed, but that must be appropriately disclosed. And also, if you see the financials of any company, if they change the method of inventory valuation, they disclose also the impact for the change. One process which they followed, the inventory could be valued at X, and the new process which they adopted, that could result in, for the same thing, X minus something, or maybe X plus something. So like that, the disclosure to be made appropriately, whether it's a cost statement or any operational data which is you are supposed to disclose. Similarly, you are to ensure that accuracy in your statement which is prepared. Suppose a cost sheet must be accurate. If it is not accurate, whether there are casting errors, whether there are posting errors, whether there is presentation error, whether there are errors like you have not considered a particular item, so that has to be avoided. because the presentation must be reflective of the true situation. So cost statement or product or a service, that or whatever be the area, the value disclosed must be reasonably accurate. So if you go through all these, this common tune is everywhere in every CAS. Like if I consider CAS 5, determination of average cost of transportation. So all of us know what is transportation. Transportation is cost of bringing the goods in the proper place. So uniformity in the application of principles and methods used in determination of averaged equalized transportation cost. So again, that uniformity in the application of principles and methods. Prescribe the system to be followed for maintenance of records, for collection of cost of transportation, and apportionment to cost centers, locations, or products. So as I said, what is transportation? Transportation is for bringing the material as near as possible to the place of use. So transportation apportionment to cost center, that has to be there. So again, you have to ensure that the data collected for transportation and apportionment are accurate and the data also captured correctly. To provide transparency in determination of cost of transportation. So what is your objective? Accuracy, transparency. So these are again the common objective of any CAS. That presentation of cost statements or service which is accurate. Again, capacity determination, the capacity with reasonable accuracy. That means again the correct capacity. The language may be something here and there, but the basic objective remains same, that your result or your analysis lead to a reasonably accurate picture. Now come to the, say, classification of cost. So there are different way of classifying the cost, nature of expenses. Expenses could be material, could be man related. Again, this could be direct and this could be indirect. Which is what is indirect? Where the expenses is common, it is apportioned or absorbed. So that is overhead expenses. And direct is which is directly attributable to the cost center or cost object or product or service or activities. So ultimate aim is in any of the units, it must be perfectly reported with again reasonable accuracy or near accuracy or correct. Say inventory. Inventory cannot be just only 1 and 100% accurate. So it is near to accuracy. We try to be 100% accurate, but say in a bulk material, it is not possible because in where the 1,000 dumpers material is there, in all the 1,000, the vehicle condition was same. So assuming this is too much. So 1,000 dumpers material, each and every dumper loaded, unloaded, weighed, process is fine. So it is near to accuracy. It cannot be said that it is 100% accurate. Just like in our financial reporting system also, we say true and fair. We never say true and correct because true and fair means it is fairly accurate. Here also it is fairly reasonable and accurate. Classification by behavior again, fixed cost, variable cost, semi-variable cost, there are different natures. So again, in the classification of cost also, the fixed costs which are identifiable as fixed cost, fine. Variable cost, again, fine. We know the definition of fixed cost, variable cost. So accordingly, the clustering should be made so that it can give at the end of the day the accurate picture. In capacity determination also, installed capacity, normal capacity, utilized capacity, idle capacity. Again within idle capacity, there will be normal idle time, there will be abnormal idle time. So when a machine is in regular maintenance, means say weekly maintenance for a few hours, 6 hours, 7 hours, 2 hours, 3 hours like that, then it is the normal idle time. The laborers will be paid, no problem, because that machine requires such stoppages. Now, if the shaft of the machine is being broken and the machine is not in a position to become operative 10 long days at a stretch, that cannot be definitely a normal idle time. That's definitely an abnormal idle time. So like that, every aspect of the expenditure to be considered for this capacity determination. Install capacity, tag given by equipment manufacturer, operational constraints, determine normal or actual operational capacity, difference between install capacity and normal capacity, difference between normal capacity and actual capacity, all these are reported. A machine can produce in a minute 100 chocolates, but presently it is producing 50 chocolates in a minute. So the machine is not running at its normal capacity. Reason could be any. So again, you have to ensure that the reason is justifiable or justified, and it is the present scenario may continue because of that reason. So why 100 chocolates are being made to 50? Machine is still there, machine is in good condition, because the market demand is very limited. So it is not wanted that we should produce 100 chocolates in a minute. So better run it for 2 hours at 50% capacity. So they are getting 50 chocolates. So like that, in every place, you have to see the data and ensure that the underutilization or overutilization, whatever be the reason, that must be disclosed. So reason for capacity underutilization or abnormal cost due to capacity underutilization. Because why underutilized? Just now I mentioned that the market demand is not that much so that company can produce higher number of chocolates. So they decided to go in this way. So underutilization of capacity. So the reason is also there, and also the fact that 100 chocolate per minute is not going to happen. It is 50 chocolates per minute. So capacity underutilization, you have the reason, and this is again treated as a performance indicator. So why the performance is poor? Because the market demand is poor and company is trying to adjust the poor market demand through its utilization of production capacity, or rather underutilization of the production capacity. Now again, overhead, production and operation overheads. So under each of the cluster or category under cost accounting standard, the basic purpose is, as I mentioned and mentioning repeatedly, that to get a clarity, to get accuracy, to ensure the reason which attributed to such a condition. So exclusions are in the overhead, finance cost, abnormal cost. So since abnormal item is not a regular phenomena, that is why always abnormal costs are excluded. Basically, abnormal costs are charged to P&L account. So that is why this is excluded from this concept of costing purposes. Subsidy, grants, incentive received shall be considered for reduction in product cost. Variance between standard and actual is part of cost. Fixed part absorption based on normal capacity or actual capacity, whichever is higher. Variable part based on actual capacity utilization. So how a cost has to be absorbed? What are the classification of that cost? Everything is specified. So what I tried is that in your study material, you will find it is 4 pages at least, 4 to 5 pages for each of the standard. You may not get that much of time for revision just before 1 hour before the examination. So remember in your book, you can highlight this part or the things to remember, which is minimum availability of time and which will enable you to answer appropriately in the examination. That is the purpose of making the crispy notes. Captive consumption, this is another area. In many organizations having facilities, they sell the produce also, as well as use a part of that for the captive consumption. Here again, assessable value of goods, again the old excise rule and present GST rule that has to be applied. Stock adjustments, adjustment for WIP, FG, scrap, wastages, that has to be made. And any changes in cost accounting principles and practices, because if you change the principle, then valuation will be impacted. So that is why this is important. Any changes in cost accounting principles and practices during the concerned period having materiality, the cost of production in terms of comparability with previous periods, that has to be considered. Because in the previous period, if you see previous and present, there's a very high magnitude of difference, then it's a matter for investigation that why so much swing is there. So suppose the cost of production of a particular item was 20 rupees, now it is 2000 rupees. So why that high swing? So you have to compare under different cost heads. Is there anything calculation is mistakenly calculation is being done? So like that, you can go for different checks and balances to ensure that the informations which you are going to produce are accurate or near to accurate, and also appropriate costing principles are followed. So it is not like that R&D cost, which you are mentioning an R&D cost, you have suddenly changed it to some other cost element. So R&D cost is normally the very high cost, but suddenly you charge it as a normal cost in the costing calculation. So that may be attributing to the high swing. So again, here I tried to capture just 1 or 2 lines on the nomenclatures of material cost, employee cost, and because since all these we know through our experience, since we have already worked halfway mark past the intermediate, and we are well acquainted with different costing terminologies. So you'll find that what is material cost, each and every one of the final examination, those who are appearing must be knowing this, that what is material cost. So I have not gone into that detail. What I tried to mention is that uniformity and consistency, the same point in the principles and methods of determining the material cost with reasonable accuracy. So this is the common tone which you will find in any of the CAS, whether it's a employee cost area or packing cost area or direct expenses. So with similar notion, you can address all this and reach to accurate or near to accurate result. Then again, material cost. Material cost, you know what are the material cost. Just now I mentioned that as a costing final year student, you have run quite a long distance. So you must be already well acquainted with the terms that material cost includes, what the include material cost is. So raw materials, process materials, additives, bought out components. So different industry use the same term in different way, like additives in cement, fertilizer, in chemicals, you will find this word additive. In cement, say with clinker, or for manufacturing clinker, additives are given, chemical additives, which is basically a binder, so it binds. So that is additive. Bought out components, when you talk about these components, this component bought out could be in any industry, not only in automobile, but this is often used in or very frequently used in the automobile industry, that bought out components. So Maruti car having 8 to 9,000 part numbers or parts, but out of that, more than 95% are bought out components. So that means as per Maruti's specification, the manufacturers used to produce that, and their produce or their particular item can only be fitted in a Maruti vehicle. That is the beauty. So tire can be used in the SUV tire, any SUVs, if it's a SUV tire. If it's a truck tire, then that can go in any truck of that particular carrying capacity grade. But say component like steering is in every car, but steering per se for all models are different. Even if Maruti having 30 models, the steering for 30 models is different. So the steering manufacturer, he, as per Maruti's desire for a particular vehicle, say it is Swift Desire, old model. There are within the Swift Desire also there may be 3-4 models which they are running. So for the purpose of simplicity understanding, I am saying that old model, new model, high-end model, low-end model. So within these 4 also the steerings are different. Since the steering is different, steering rod is different. So the company who manufactures steering, all the 4 varieties, he has to get this 4 type of steering manufactured for Maruti. Now assume that they are also the supplier of Mahindra and Mahindra or Tatas. Then same will apply there for them also. So these bought out components are those components which can be purchased from some manufacturer and directly used in the produce, but or provided that falls in line of the design, drawing or expectation of the manufacturer. Closely associated with this bought out the another term, which is make or buy. When you making it, suddenly you may find that your making cost is very high, and the same thing if you order to a third party co-maker, then it is coming at a cheaper rate. So you switched over to buy. So buy is basically resulted in such bought out components. Sub-assemblies. So assemblies are the main assemblies. So radiator assembly. Within radiator assembly, there are sub-assemblies. So again, a bought out component. Every car having a radiator. So radiator is being maybe manufactured by ABC, and within the radiator again there are sub-assemblies. So sub-assembly again not necessarily by the ABC, then maybe by C, D, P, Q, like them. So they buy from A, C, P, Q, and they assemble it in their plant to make an assembly of radiator assembly, which they in turn supply to Maruti, Tata, like that, as per their design and drawing. So that is basically relating to the automobile industry. And semi-finished goods, again, this is the term which is used mostly in the chemical industry, where say if I talk about the aroma chemicals, so up to one stage, the material is same. Now, if you want aroma of rose, if you want aroma of jasmine, if you are trying to get aroma of some other flower, then there the chemical component or compound is different. So semi-finished up to one stage is same. After that, when you put that particular tint of color or smell, then it's a different product. So why I'm saying this, these are very typical. So I thought I should share my experience. So material cost consists of all these elements. Now direct materials are again those who are can be attributed directly to a cost object, can be directly attributed to the cost object in a feasible way. And indirects are which are not direct. So which are not directly attributed to particular cost object. Then there are scrap. Scrap is discarded materials having no significant value, but at times may have a significant value. When the price of iron goes up, then the offcuts of iron, they also become costlier. Say if it is now iron scrap is 10 rupees per kg, when the iron price is say 80 rupees per kg. So like that, there's always a difference. But if the price of iron goes to 90, the scrap price will also move by say 1 rupee or 2 rupee. So that is why the scrap is very important for certain industries where the scrap can be melted and that melting will give the original raw material. And wastage is always a loss. So material lost during production or storage, generally called as wastage. We say cotton waste. We say wastage of different materials. Spoilage again includes production that are not passed quality test. So basically a defective product. Sometime in some industry, the defective products also can fetch some value. But in most of the cases, it can be sold as a lump sum also. And valuation, which is again due to different method, because LIFO having some impact, FIFO having some impact, weighted average having some impact. So FIFO, LIFO, weighted average, whatever be the method you are using, your inventory value is bound to change. So material cost, monitoring material cost, again requires consistency in valuation, consistency in treatment. So the material, the way you process it for the finished product, if you have changed that, then the material cost will vary significantly, may vary significantly. So all these things are to be kept in mind while reporting, and cost of the standard basically guides us in this respect. There are normal losses also, normal loss or spoilage prior to receiving, say oil in containers. Most frequently happening instances that containers are not properly sealed. So some oil oozes out, some may be recovered, and some may not be. Some can be covered through carrier insurance. You are transporting through tanks the material, which is, even if you see the oils in the railway, you will find that there's a caution mark that not to be loosely shunted. So the oil tanker carrying such message, but at the same point of time, you will see the petroleum somehow oozes out. The marks you will find in many cases may not be dangerously, because if it is dangerously, then the vehicle can be destroyed by fire. But little bit here and there, you will find that some oozed out, and that's a quite normal phenomena. But these are again treated as normal loss. An abnormal loss is that which is say same oil tanker made an accident and you lost the entire product and subsequently recovered a very small value. So rest is your abnormal loss. Losses due to evaporation, shrinkage, gain due to elongation shall be considered in material cost to the extent they are normal with corresponding volume adjustment. So again, repeatedly the same thing I am saying, that normal, anything normal is to be considered, anything abnormal not to be considered. Say in winter, petroleum squeezes, which is quite natural. So what is the percentage of squeeze? It is within a tolerance limit. So it is better to recognize inventory at the same unit, same volume. But if the shrinkage is very high, say 50% evaporates, so then it's an abnormal situation. So that abnormality has to be taken care of. Any abnormal cost is not considered, that is excluded from the material cost. And any abnormal cost also treated in the profit and loss account, not in the cost statement, not considered for the purpose of cost, because that's because of abnormality. Employee cost, again, benefit paid or payable for the services rendered for permanent, contractual and temporary deployment. Compensation paid to employees for the past period, dispute or court order shall not form part of employee cost. Short provision of prior period made in current period shall not form part of employee cost. Difference between time paid payable for and time booked on cost object is to be treated as idle time. Indirect employee cost forms part of overhead. Subsidy, grant, etc. are to be reduced for ascertaining employee cost. So indirect employee cost forms part of overhead. So any indirect, in the first I said this, that direct is which is attributable directly, even for the raw material, even for the labor, but which is common, not directly attributable. Either it is to be absorbed under different principles or it is to be allocated under different principles to different cost centers. Those are treated as overhead expenses. And the labor also is no exception. Here also, indirect employee cost forms part of overhead. Next is cost of utilities. Cost of manufacturing standby utilities shall be committed cost. Any utility created as backup against any failure of the main source of utility is called standby. So I have one generator and I kept another generator. On emergency, if the first one is not operating, then I will operate the second one. So that generator is called standby. So each type of utility shall be treated as a distinct cost object. So standby generator is a separate one, and main, which is operating one, that's a separate one. So cost of self-generated utilities for own consumption shall comprise direct material cost, direct employee cost, direct expenses, and factory overheads. Cost of utilities purchased shall be measured at cost of purchase, including duties, taxes, transportation, insurance, and other expenditure directly attributable to procurement. Cost of utilities generated for the sale to outside parties shall comprise of direct material cost, direct employee cost, direct all directs, and factory overheads, distribution cost, share of administrative overhead, marketing overhead. Sale value also includes margin. So differential is the margin. Today we'll be able to complete up to 10, and the balance part will be covered in the next class. So 9 is the packing material cost. Any material used for packing of a product is a packing cost. Now packing is of two types, primary and secondary. So if we think of a soap, say Hindustan Lever Lux. So Lux you will get with a thin paper packing when you buy it. So that is called primary packing. But when this Lux in 144 pieces put in a cardboard box for transportation to different dealerships, that is the secondary packing. So secondary packing material is used to store, transport, and sellable unit identification. The example which I have just now given. Purchase of packing material shall be valued at purchase price inclusive of taxes, duties. Credit refers to the trade discount, cash credits, and rebates. Cash discount is not deductible. Abnormal losses are not includable, while normal losses are includable. So same thing, any abnormal item not considered. Forex components of imported packing material shall be converted based on the rate on the date of transaction. Any further changes does not form part of cost. So when the agreement signed off for importing packing material shall be covered based on the rate on the date of transaction. So today is the date of transaction. This today's rate will be considered. Even in your financial accounting also you'll find the same thing. The current assets are valued on the date of, for the branch accounting purposes or departmental accounting foreign branches. Basically, there you will also find the same thing. So valuation technique is same. Now the last one is direct expenses assigned directly to the cost object. These are expenses relating to manufacture of a product, rendering of a service which can be identified or linked. Expenses related to manufacture of a product or rendering of a service which can be identified or linked with cost object. Bought out resources shall be valued at invoice value or agreed price, including taxes, duties, and all related expenses, net of credits. Lump sum expenses or one-time payments shall be amortized on the basis of benefits longevity. Self-created direct expenses shall be valued at total of direct material cost, direct employee cost, direct expenses, production overheads, and administration overheads relating to production. So we are closing it today. We are just on dot, and we will start the other day from 11 and we will conclude up to 24. So still we are 14 left and we will cover the other chapters simultaneously. So we have covered 14, 15, 16 and all on CAS standards halfway mark. So this is the net outcome of our 2 classes, and definitely I will try to finish it off by the entire course, at least the gist part, so that before examination you can prepare yourself. There is no alternative for you reading. Just these are your whatever I am delivering here is the thought-provoking ones and the probable tips, the way which you can easily handle it. So thank you till such time for the next session. Thank you for your attention, patience, and understanding. Thank you.
Thank you, sir.
Thanks a lot.